Hi guys, hope you're doing great. So for today, I can say that instruments are a gold mine for your exams, whether it's gonna be university or it's gonna be any entrance exams that you're preparing for. And the examiners love them not only because they would like to test your memory, but at the same time, I mean, they would also like to test your clinical sense as well. So it makes sense to practice these instruments, and that is why we're conducting these couple of important sessions which are like X-ray based, ECG based, instrument based, so that you can fine tune your reflexes according to them. Now most of the time you will notice that, and I try to incorporate this in this session as well, that they are not only going to ask you regarding the name of the instrument, but they'll also ask you regarding like where the rationale behind its use, or at what step during surgery would it be used. So the difference between the ability of yours to differentiate between a cryal artery forceps versus a Kelly's forceps, mosquito forceps, or Cocker's forceps for that matter, in that limited time frame, because when you attempt those questions you get under 1 minute, then ability to discriminate or differentiate between them in the shortest possible time frame matters the most, and that would help you in amplifying your scores. So with these words, I think we can get started for today. And very good evening everybody. Mahesh, SRK, that's an interesting one. Okay, SK, not SRK. And Pratik, then Nick here. So fine, man. I think we're good to go and sorted for today. And you can hit the comment button as soon as the image flashes in front of you. He says patient requiring a laparotomy. I think that made it a little much more easier for you guys. And he says that this is used in abdominal retraction. I mean, if you have attended uh, any if you have been a part of any surgery in your internship, you know how boring and tiring it can be while holding the retractors. So I mean, this was a gentleman who actually was fed up of standing those long hours, and therefore he decided to deploy a self retraining retractor. Yes, you can see, on the sides, you can see that this is a Belfour retractor. So today we are doing spots here, a very simple and a straightforward question, because anyway, I have helped you by saying that this is a retractor. Now, only thing that you can check out here is that this is a retractor that would be used during laparotomy, mainly to provide a deep exposure to the viscera, right? That's the main objective. And Langenbeck retractor will be having a right angle. It will have a long handle, L for Langenbeck and L for like a long handle. And the Morris retractor, you will notice, will be having a shorter handle, but like the blade of that would be relatively much more broader. And I'll show you the images for the Morris retractor as well. And as far as the Doyen's retractor is concerned, it will have that, that curvature present, because you are mainly using it during a lower segment cesarean section to prevent the injury to the bowel, or prevent injury to the bladder. So as far as the shapes are concerned, they are like gonna help you a lot. And yes, the main point is that this is self-retailing, because as I said, it can be really boring and tiring just holding the retractor. So that is why Befoor, he decided to make this. This guy was, I think, I mean, he's an American surgeon, and it was either Cleveland, or I forgot, it was either Cleveland or maybe Hopkins, where like he designed this retractor which is self-retaining. So the correct answer for this is option number A. And if you just focus on the images which are currently on the slide, you can see the curvature. So this would be a Doyen's retractor. That is one. Then when it comes to uh, the second and the third images, you can notice that one of them is having a long handle, and this longer handle at the same time is having a much more shorter, I would say, blade from the breadth perspective. So this would be mainly for superficial fascia. But when it comes to Morris, I mean, how do you remember it? M for Morris and M for massive. M for Morris and M for massive. I mean, you can see that the blade of this is pretty massive. So this would be mainly for helping you retract the deeper tissues or deeper abdominal layers when the dissection is being done by the surgeon. So the correct answer in this case is option number A, as I think most people have already picked up. And as far as the shapes of the remaining were concerned, they're also sorted up here, very spot on. As I said, this is a gold mine. I mean, the moment you pick up the shape, it would help you in identifying the particular retractor. So let us move to the second one as well, where yeah, I mean, it's not about gynecology or obstetrics. It is more about being able to pick them in the shortest possible time frame. uh, uh, Fine. Yes, you can notice that Wrigley's forceps will be much more shorter in size. I mean, the handle of that is also much more different. So if you look at the current one, this is like a long forceps. It is having a cephalic curve. It is having a pelvic curve as well. So especially when you look at these two areas, that is the cephalic where the baby's head would be present, and then the pelvic curve is also there. So this in these particular circumstances would help you identify that what we are dealing at the moment is a Simpson's forceps. That's relatively easy. The main concept in this was it's a long forceps. The second is the cephalic, and the pelvic curves are distinctly visible. In contrast, when you look at the remaining ones, you can easily identify them. I'll just put a pointer here to say that this would be Wrigley's outlet forceps, where the handle would be also relatively shorter, and even the blades of that would also be relatively shorter. And then you can pick up the particular appearance of the handle of this one. This would be called as keeled forceps. And the last one that I have shown before you, this is having like the blades of this are totally different from the previous ones, because in the other ones you can notice that there is a fenestrations that are present. But in the one that I've currently shown, it's more like, like if you order noodles in a Chinese restaurant, they'll be using those tongs. Those tongs would not be having any kind of fenestration. So here you can notice that it's like a proper blade that can cover the head of the child. So this would be a Tucker McLean forceps. So I decided to put up a easier one for you guys so that you can get, uh, uh, that confidence in attempting these questions. And then you will notice that we'll try to incorporate a couple of tricky ones as well. So Wrigley's was shorter, Simpson's is relatively longer with the pelvic, and at the same time along with the pelvic, I said the cephalic curve is also very well distinctly visible in this case. Keeled's, the handle part gives a much more better orientation. I mean, you can notice there is no interlocking present here, right? Unlike the previous handles, which are going to be interlocking, here you can notice two distinct parts present. And then the last one can be picked up, the Tucker one, on a sense that that was more of like having not, that is having lack of fenestrations. So we can move to the third one. And this instrument would be used by an anesthesiologist or a critical care specialist. So you can hit the comment box. Obviously, it's not a laryngeal mask airway. It's not an endotracheal tube introducer or a boogie. So yes, you guys can quickly comment about this one. As I said, I mean, do not assume answers to a question. What I am doing today is that I decided to start with easy ones so that you get into the groove, like you put the car in the first gear and then you gradually accelerate. But yeah, this is a Berman's airway. This is not a Goodell's airway because there would be no fenestrations present here. The disadvantage of Goodell's airway is that all the secretions in the corners of the mouth that would be present are difficult to aspirate. But here you can put in a suction catheter, and this would help you in identifying, or this would help you in aspirating the secretions which are going to be present on the sides as well. So this would be a Berman's airway, not a Goodell's airway. The difference is the one that I wanted you to appreciate. In case of a Goodell's airway, the curvature would obviously be identical, but then I can say that when it comes to a Goodell airway, the flange of that or the appearance of that would be totally different, in a sense that it would not be allowing you to do any kind of suction from the lateral aspect, whereas in this, the fenestrations that are possible or are present. If I zoom it in, you can see that this is not a Goodell's airway and this is a Berman's airway. So good pickup by most people. Yes, initially, like I did find that people were having a lag. Laryngeal mask airway to bache nahi hoga na. I mean, that will have a proper, like, a proper, I would say, appearance of like a fenestration. This would be having like a proper seal so that you can deliver the anesthetic gases. So laryngeal mask airway would be appearing totally different from the ones that would be discussed at this particular point of time. This is a Berman's airway. So I think we are sorted for the third question for today. That is easy to pick up. And now we change gears, that instead of talking about some instruments that are used in obstetrics, we talk about instrument which was instrumental in cataract surgery. Now, nowadays, obviously, we have phacoemulsion available. So in phacoemulsion, there would be a titanium needle that would be oscillating, and we would be making a very small incision in the cornea, only about 2.8 millimeter or so. But I can say that when I was a student, then, then this extracapsular cataract extraction was being done. And there you can see that this is going to help in basically delivery of the lens nucleus. This particular part would help in delivery of the lens nucleus. So we will be calling it a wire rectus, and the correct answer for this would be option number B. बच्चे जो lens scoop होता ना, that would be different. इसी की दूसरी साइड पे दिखाऊं ना, तो there would be like a bulbous end present. So sometimes you might be noticing that on one side you might be having a lens scoop. That lens scoop will be having a bulbous tip at the bottom. But at this moment, I said बच्चे ये कैनुला तो कहीं से भी लग भी नहीं रहा है ना. This is not looking like a cannula. So this would be a delivery of the lens, as I said, lens nucleus in an extracapsular extraction of the cataract. पुराने ज़माने की बातें हो गई हैं, but still because they love to ask about the instruments part, so we need to know about this, the lens nucleus part. And like somebody said, lens scoop, so that would be like a bulbous end at the time, so that's why it can be ruled out. And then irrigation aspiration cannula to nahi lag raha hai. This doesn't look like a cannula anyway. So even if I was like, guessing this one from cataract surgery perspective, it would have been either A or B, not a lens scoop. And the correct one here is a wire, because it looks like patla sa wire, round wire, no, that helps in removing the lens nucleus where like a person is having a senile cortical cataract. So the correct answer for this one is option number B. And now we have a very good hemostat that we can see at the moment. So there are multiple varieties of hemostat that we'll be discussing, like Crile or Kelly's. So in this case, it's having that short, very short one, right? The other ones would be relatively bigger. So this would be a mosquito artery forceps. Yes, the correct answer for this one, hit the correct button. Hit the comment button soon, guys. This would be a mosquito artery forceps. When it comes to Cocker's forceps, उसमें तो दांत होंगे ना ऐसे. The Cocker's forceps would be having that teeth present, especially if you want to hold out tissues, right? So Cocker's forceps would let you basically handle tissues relatively better. And when it comes to Kelly's and Crile, so Crile जो होता है उसमें all through, there would be serrations which are present all through. And when it comes to Kelly, then the serrations would be present only in some part. Like if I just redraw this, in Kelly's artery forceps, the serrations would be present and they would help you crush the tissues, but only in some part of the way and not the entire pathway. And now I'll show you the actual images for the same as well. So the first one that you can see is obviously mosquito forceps, as you answered very correctly. And when you focus on the second one, then you can notice it's having a half serrated clamp. So because it is half serrated, that is why this one would end up being called as a Kelly hemostat. When it comes to Crile, as I said, don't go by the curvature. It is like the teeth that are present, the serrations, जो छोटे serrations आपको दिखाई दे, they would be present all the way on. And the last one that you can pick up is a Cocker's forceps as well. So therefore, the correct answer for this one is mosquito forceps. This was again an easy one to be picked up. And I'll just show the image once again. The comparison between the remaining ones is what I have also done. So in this festive time when people would be, chilling around, yes, it's good that you guys are trying to put in the best possible efforts for today. Yep, that's right. Yes. Okay. So we can move on to the next one, which would be event that would be used in, okay, maybe it's coming behind me, so I'll have to zoom it out. So when it comes to like the instrument used for a tonsillectomy, even the look of it, it looks like a snare that would help you identify this. So even if I would be guessing in this case, that would make it easier for me. That is a Eve's tonsillar snare. For any ENT surgeon, this would be the first surgery that they'll be doing. That is a tonsillectomy, and especially the inferior pole of the tonsil, when it is hanging that delicately, that is when they'll be using this snare here. So the correct answer for this one is option number B at this moment. So good that you are hitting the comment button at the moment. And then you can also see a adenoid curate at the moment, though I'll put up a question on the adenoid curate subsequently. This one was for tonsillectomy. The next one on the agenda is an OBG instrument that we study as a uterine sound, and this uterine sound will be having specific functions as well. You would have seen the gynec using it whenever they're planning to do a DNC or they're planning to put in a copper T, because it would help you identify the uterus is anteverted, retroflexion. It would also help you in estimating the length of the uterine cavity as well. So yeah, the remaining options are very simple, straightforward. Grasping the cervix is gonna be valsalem, so I can rule out C. It's not gonna help me dilate a cervix. It's not a cervical dilator. That's a Hagar cervical dilator. And what I'll do is measure the uterine cavity length. So this is a uterine sound, pretty straightforward and easy to pick up. Then he has asked not regarding the name, because you can see that this would be helping in picking up delicate tissues. This would be called as a Babcock forceps. This is a atraumatic forceps. The advantage of this Babcock forceps would be it would help you in identifying, it would help you in picking up those delicate tissues like fallopian tube, or if you're handling the bowel per se, because you can notice that fenestration in between. So it would help you identify those delicate tissues. And yes, I think the moment I said this, and in fact, even before I had said it, it was easy to pick up that this would be holding the bowel as well as the fallopian tubes atraumatically. So, I mean, Cocker's forceps versus Babcock's, you can easily identify from the appearance in the terminal part, where there would be teeth present with Cocker's, and there would be Babcock's, which would be having this advantage of helping you picking up delicate tissues there. Okay, so easy one again. You would have seen the nursing staff assisting you, whether you're doing a lumbar puncture, whether you're putting in a chest tube, you have to fix the drapes. So the moment you have to fix in the drapes, this small clip would come in handy. So at the moment, I'm not talking about those hemostatic clips. You know, normally when I talk about peptic ulcer disease, the guy is having a GI bleeding, then we go in for a endoscopic hemostatic clips. But at the moment, it is like during surgery only, that the way they are placed, like they would help you in getting that minimal traction between the sheet and the superficial and the skin of the patient as well, so that you can hold the drapes in position. So yeah, fixing tubes and catheter to the drapes and holding the drapes together, I think like between the two, a much more appropriate thing would be holding the drapes together is like a much more important job for these, rather than fixing the tubes and the catheters to the drapes, right? I mean, during surgery, I would not be fixing any tubes and catheters to the drapes at the moment, right? So it is like just getting your operating field very well organized. The answer to this is option number C and not option number A. As I said, we just need to put a orderly appearance to the operating field. The correct answer to this is A. Okay, so the current instrument, maybe it's a little smaller, would be having those teeth again present. So, well, what do you call it? We call it a valcellum. And this valcellum would help you in grabbing the cervix, especially if you have to do a like artificial rupture of membranes to expedite the labor, then this instrument would be assisting you. So the correct answer in this case would be option number A. Yes, grasping the cervix is the main point. And like I said, if you're planning to do a ARM, artificial rupture of membranes, in case you want to expedite the labor, then this would come in handy. So the answer to this would be option number A. Okay, lux forceps is pretty straightforward. The curvature of it would let you know that this is not gonna be like a surgeon who would be using it, a GI surgeon. This would be like an ENT surgeon who would be using it. And if it's gonna be a ENT surgeon using it, then for the lux forceps, as you can see, it would be mainly for this would help you in going ahead with, okay, so in between the chart just disappears. Okay, fine. So this would help you with respect to a polypectomy. So you need to get an idea with respect to, like, you know, how these instruments would be looking in the very first go, and then pick them up in the shortest possible time frame. Yeah, cockers would be like having teeth present, and that would be for grabbing the fascia. Well, Salem, the teeth would be like much more bigger, right? And because like in this question, it was OBG instrument written. So that is why, like, I think we made it relatively easier for you, because if it's gonna be a like a huge big forceps, you can imagine, you know, because it has to be like the gynecologist would be holding it, has to go through the entire length of the vagina, holding the cervix. So this is, well, Salem is gonna be much more bigger in size as compared to as compared to a Cocker's forceps. Okay. uh, two retractors which had made life easier for any, I would say, surgeon. One, I showed you the first part, that is Balfour's self-retaining retractor, and second is that ENT surgery where, like, you know, dissecting the mastoid, because they have to identify, because the mastoid anatomy is going to be complex and the surgeon is going to be doing a modified radical mastectomy. So the exposure part is very, very important. So this would be a Mollison mastoid retractor. Good, guys, this is an option number A, and the remaining ones can be easily ruled out. I mean, the very shape of it helps you identify the previous two that I said. I mean, the shape of these help you identify that, okay, we are dealing with some delicate structures in the upper respiratory tract, as I can say from the ENT perspective. The correct answer for this is option number A. Now we come to that uh, I mean, the adenoid curate that I was talking about, and this adenoid curate will be having a cage. The advantage of that cage is that, okay, so if I say that, then the answer will become much more clear. But you can see that this cage is the one which we have to attach, and this would help you in grabbing onto the tissue and will prevent the tissue from getting dislodged. So the correct answer for this is option number B. And meanwhile, I'll just put up, okay, no, not cutting the adenoid more sharply. It is basically having a cage, CAGE. And what that cage does is it's detachable. The cage is detachable. Like at the moment, the two parts of it, no, they look very close to each other. They can be separated, and these help you in grabbing onto the tissue that has been removed. So the correct answer for this St. Clair Thompson adenoid curate is option number B. And you can comment in the chat box if a patient is undergoing a tonsillectomy, then during tonsillectomy, like what is the most common source of bleeding? I hope I don't need to give any options here when it comes to tonsillectomy. You guys can quickly tell me there, right? That intraoperative ones that would help you immediately. Yes, guys, tonsillectomy intraoperatively. The guy is bleeding, right? Intraoperative bleeding, and he says what is gonna be the source which is present here. Yeah, it would be answered as a DB vein. It would be the tonsillar vein or the DB vein that you would be answering. If it is post-operative, then it can be the branches of the facial artery, but otherwise it would be a peritonsillar veins only. Yes, I mean during tonsillectomy, I can say the word DB vein or I can say the word peritonsillar veins would be the major source of bleeding intraoperatively. And if it's gonna be post-op, then most of the time it would be answered by you as the branch of the facial artery, branches of the facial artery. The correct answer to this one is option number B. Now we have two screws. One of them is like, having very fine serrations, and the other one is like much more coarse, because if I speak more, then the answers will become obvious. So let's have it from you guys. Select the correct options in this case for the screws that you would be using to fix a plate during an open reduction and internal fixation in a patient. Okay, Vaishnavi Gupta is like the first one to hit the comment button. And yeah, I mean, what you are gonna do here is, if it's the fine serrations, then these fine serrations are the cortical one. And for this cortical one, I can say the logic is the bone is more organized. Like if I'm gonna be fixing a plate to the diaphysis, where the bone is gonna be relatively more harder, it's the fine serrations. But if you look at the second one, the cancellous one, this is for the more porous part of the brain. I would say this kind of a screw is mainly for the porous part of the bone. Porous part of the bone can be like, the epiphysis or the metaphysis. So especially when we are going to be working on the metaphyseal part or the epiphyseal part, that is where this kind of a cancellous screw would be useful for a patient, where the serrations would help you enter into the porous bone and hold there, right? I mean, I need more surface area. The logic is because it's a porous bone, so I need more surface area to be able to hold the screw in that place. Whereas when it's a much more organized bone, the serrations can be relatively much more smaller in their caliber. So the correct answer to this question is option number A. That would be a cortical screw as well as a cancellous screw. The first one, that is cortical, is for diaphyseal, and for cancellous it would be fixing the tissues which are damaged during a fracture, like a metaphyseal or an epiphyseal one. So we move on to the next one, which I think I can answer myself only. That would be a periosteal elevator. So you are hitting the nail on the head. I can say the instruments part are relatively a easier one to be picked up. And as we'll keep on going in the discussions, then what you will see is, like in the subsequent discussions that I'll be taking on YouTube regularly, scheduled for this month, we'll keep on like making it much more trickier for you guys. But this is like a confidence building session that we're doing at the moment. Okay. Then is a DB splint. That would be Dennis Brown splints. These would be basically helping you in doing that cave, right? CAV. I mean, which part would be treated first? The cavus part and the equinus part would be handled subsequently. And once you're done those, that cave mnemonic that you study, then you always read about that DB splints that you would be using. So the Dennis Brown shoes that you'll be using for any patient of CTEV, that would be for a clubfoot in a patient. So this, I think, was relatively very straightforward and a very easy one. Yes, the correct answer to this one is option number D. Then you can see something that looks like a plus, right? Like a plus that I would say, technician would be using. One is having like that big that big bite, I can say, and the second one is looking more like a nibbler, right? It can help you in much more smaller ones. So one is a bone cutter and the second one would be a bone nibbler. Yes, the correct answer for this one is option number B. Good. Then we come to the remaining two slides here. We have a Boyle's apparatus. So this would be helping in delivering of anesthetic gases to the patient. Yeah, cutter and a nibbler. You're right, Suryansh. And then is the controlled delivery of anesthetic gases and oxygen. That would be one of the main thing for Boyle's apparatus. And whenever the patient is exhaling out, there would be these kind of granules attached to the Boyle's apparatus, which will change their color from purple to yellow. That purple to yellow change that is present, that purple to yellow change that is present is mainly for, like, that exhaled carbon dioxide, I mean, that absorbing that carbon dioxide from the exhaled gases. So the correct answer for this one is option number B. So what we have done here is, guys, like in almost like previous 27 minutes to be precise, we have done about 20 quick images, pretty spot on, pretty straightforward, and only like couple of them were misses for a couple of people. Like, the moment I made the options a little offbeat, then like in maybe the third or the fourth question, then there were a couple of errors. But otherwise, like when it comes to these instruments, as I said right in the beginning, it is like a gold mine for your exams, whether it's going to be a university one, whether it's going to be a Viva, whether it's going to be any entrance exam that you'll be sitting for in the future. So yep, this was a quick random rapid fire series, I can say, at the moment. And thank you so much for joining. So we have multiple things I have lined up for this particular month. Especially we'll be doing ECG subsequently. There's a mini test that is also scheduled, so I'll be taking a live discussion of the same as well. So you need to just practice those questions on a daily basis, and whichever that go wrong, I can say, are the ones which are to be looked at. I mean, there can be two possibilities: either you did not know, or you knew but it went wrong. And those where you knew and it went wrong are the ones which basically need to be fixed. So yeah, we have an ECG one lined up because INI-CET would be having ECG one. So I'm going to give you a couple of tricky ones as well. In fact, at this moment, before I sign off, I want to say to you that I have conducted ECG. I mean, on YouTube only, there is like on the app only, like there is a discussion of at least I would say 4 hours. But on YouTube, we put up the initial 25 questions of that initial discussion that I did. And a couple of them are, the first one starts with an ECG only, right? So do check out that. And I would like you to comment in the, comment in the video itself below. I'll try to answer you there regarding what you thought for the diagnosis of this condition. Right, so do check out the recently conducted 25, I think 20 odd INI-CET based questions that I have conducted. So thank you so much, guys. And yeah, I am Punjabi, but at the moment we have to go by English so that everybody is on the same page. So thank you, guys. Happy festivities, and I'll see you again once again on a different day. That would be, I think the next session would be scheduled as a mini test, and then is a ECG based session. So take care, guys. God bless you.